nearly 7 months pregnant when she experienced terrible pains in her stomach. Jim checked her into Virginia Baptist Hospital, but when the doctors there learned she was expecting triplets, they transferred her to the University of Virginia. On July 2, 1984, Debbie gave birth to 3 identical girls. Each weighed about 2 pounds. The doctor told Jim that the third baby almost didn't make it. All 3 had needed a small amount of blood, which was not unusual for such premature births. The third baby remained in intensive care for 2 more weeks because of respiratory problems. She needed several blood transfusions. Jim left their naming up to Debbie. For a while, they were babies A, B, and C. Then they were named in order: Heather, Holly, Haley. It was hard to tell them apart, but their personalities soon emerged. Holly was the leader of the 3. Haley was a clown who loved to entertain with funny faces. Heather was quieter, the more delicate. They had the usual childhood diseases, colds and problems with ears, noses, and throats. No sooner would one girl get well than the next would fall ill. Nonetheless, they were happy, rarely cried, and never complained. One morning in early March 1985, 8-month-old Haley awoke covered with tiny purplish spots. It was, Jewel observed, as if someone had taken a pen and dotted her entire body. She had never seen anything like it. Dr. Frank Salisbury, a pediatric immunologist at the University of Virginia, had not chosen medicine in order to attend funerals of children, but death came with the territory. Salisbury was attending physician on the general inpatient ward service and occasionally consulted at NICU, the neonatal intensive care unit. One morning in August 1983, he was discussing some cases with a young resident, Dr. Randy Wyckoff. When they reviewed the young patient's charts, they were struck by the condition of 3 of the children. A boy and 2 girls, each 8 months old, were suffering unusual illnesses, which raised questions about their immune functioning. Wyckoff recognized these children from their last hospitalization at NICU in November 1982. Here they were back again at the same time, less than 1 year later. Salisbury was aware from his readings of an emerging immunodeficiency disease called AIDS. By August 1983, compelling evidence suggested transfusion-associated AIDS in adults and children. While he conducted diagnostic tests on the 3 infants, Salisbury reviewed their NICU records. He found what he was looking for. All had been transfused at birth with packed red blood cells. He then checked the blood unit number. Each child had received blood from the same single unit. The University of Virginia obtained blood from the Red Cross's Washington, D.C. Center, which was over 100 miles away. UVA Medical Center contacted the Red Cross, which cooperated in locating the donor. The donor was found in November. His blood was tested at the National Institutes of Health laboratory of Dr. Robert Gallo. Gallo had been working on several assays which could detect the presence of antibodies to a virus called HTLV-3, which was under investigation as the cause of AIDS. It would later be confirmed as the cause and renamed HIV for the human immunodeficiency virus. The children's test results came back. Each was infected with HTLV-3. So was the donor. The University of Virginia physician had recorded the first documented cases of transfusion AIDS caused by a single unit of blood traced back to one donor. He informed the Red Cross's D.C. Center of his findings. As Salisbury would later recall, by February 1984, Red Cross knew damn good and well they had a problem here. Salisbury would later identify these 3 transfusion AIDS babies as Cohort A. In late February 1985, 3 more children with similar immune disorders were admitted. When Salisbury had these children's blood tested with the commercially available AIDS test, the results came back positive. He identified this second set of 3 HIV babies as Cohort B. The donor to Cohort B would test positive for HIV in March 1986, when he returned to donate blood for the 3rd time at the Red Cross. But in the interim, his second donation had already been processed and transfused. Subsequently, Salisbury became intrigued by a case described to him by a friend and colleague, Dr. Tom Howard. An 8-month-old patient that Howard had seen in March had developed thrombocytopenia, a drastic reduction in the number of blood platelets that resulted in abnormal bleeding. This, in turn,